To Ba, and I believe this is your first official visit to Ba Mission Hospital, and we take in pride to welcome you to this lovely place called Ba, the stock-accredited town of Fiji, and on behalf of the board of
It's a real pleasure to be here, to be here in Ba. Over the past, from yesterday, I've been touring facilities in Tailivu North, Ndawa Samu, Namarai, all that coastal area, up to Nanukuloa and Tongovo. What's the other place? Rundi Tongolo and all of these places. And this morning, I've had the pleasure also of going to Nailanga, Balebuto. I've gone up to the place where they had the water source that led to that problem last year. And you've just finished in Ba Health Center. So I've seen the issues. And I can tell you one thing, the problems that I've seen in Ba are the problems that I've seen everywhere in Fiji. It's a problem of trying to live up to the expectations of people in terms of how we can deliver a better service. But I'm glad to be here today. And at the outset, I must say thank you to the Board of Visitors. Thank you for showing your care that you have for the people that we have in this facility. In this Ministry of Health, we have a very simple vision. Very simple vision in the Ministry of Health is to try to develop a healthy population in Fiji through a system of healthcare that is very caring in nature. Very caring in nature. And if there's one thing that I always stress, it's the importance for us to be able to see two things in this country. First of all, that health is everybody's business. Health is not just the business of government. Ultimately, the ultimate responsibility of health lies in people's hands. And I believe that if we are to improve health, one of the first things that we must do is to try to stop people from having to come to hospitals in the first place. And that means there's a role for all of us to spread this gospel of telling people that if you do the right things, you don't have to come to hospitals. And that's something that we all need to do. It's something that's not just done by people like the boards of visitors, but all of us. In whatever walk of life that we are in, we need to spread that gospel. I was talking today when we were at Balevuto Health, or the, Ba Healthcare Service, Dr. Anna, who, by the way, I've known her from the time she was a small baby until she's now SDMO. I've seen her grow up over the years. I've known her family from a very long time. But she was telling me that in Ba, for the diabetes, the people that they have, 400 of them, only 3 or 4% of them are doing the thing that they're supposed to do to manage their disease. This is one of the biggest problems that we have. Having the awareness, telling people what they need to do to stop them from coming to hospitals in the first place. And that is something that I hope all of us in the community, all the religious organizations, all the community out there, they can demonstrate that care by telling people, first of all, by caring for our own lives, so we do the things that prevent us from coming to hospitals. I believe that's why I'm also thankful to business sector coming forth, giving forth your money. 2 weeks ago, was it 2 weeks ago, 1 week ago? Probably 2 weeks ago, we were opening the extension to the Singatoka Hospital. And I was very grateful to see the business community contributing around, I believe, around 600,000 to be able to build that facility. That again is a demonstration of caring from the business community. And that's something that we highly appreciate in this. I believe that ultimately, the way in which to handle health matters in Fiji is to have a caring attitude by all of us. Here in government, we have set our priorities. This year, we have increased the budget for the Ministry of Health by around 47 million. But it's always not enough, because a lot of the focus is going on dealing with people who are already sick. This is why we have facilities like this. We need to continue to do that. That is why we have the new Ba hospital that is coming up. That is why we are looking to develop the hospital facilities in places like Naulu, in Rotuma, and so forth. So government will be continue to provide its services in that area. So in this, I'm always very grateful. I want to tell you, the chairman and the secretary, I want you to pass on the message to the Board of Visitors that in government, we appreciate the care that you have taken, the compassion that has come from your hearts to allow you to organize and to make this a reality. So even though we know that we're building a new hospital, we're still thinking of the people. that we have to serve, people that continue to serve this facility. And I hope that the rest of the community can come and join hands with us. Because really, in this country, if our GDP goes up and we have a lot of fancy things, but if the health of the people is not improved, we don't have health, we don't have wealth. Our real wealth is the lives of our people. And that's something that we commend to you. So I look forward to this particular facility that we have. I still don't understand fully what its intent, but I know that it is focusing on our mothers. Very important, the source of life. Life itself comes from mothers. So anything to do with the mothers, and for me, I'm a person with 5 daughters. And I've got 2 granddaughters, so that I know I'm always looking at doing things for them so that they can continue to give a lot of birth, so we can have more people, but we need to look after our mothers. So Board of Visitors, to the community of Ba and to the medical team here in Ba, I commend these facilities to you. I wish you well, and I hope that it will bring relief, and it will bring a lot of caring and compassion to the people in this area. And for our hospital staff, I hope that you will make use of it well, and remember the values of this ministry must become the values that are embedded in our very lives every day. Customer focus, responsiveness, being loyal, and living the vision of this ministry so we can deliver good service to the people of Fiji. I wish God's blessings upon the Board of Visitors and all of your activities, God's blessings on these facilities, and may it provide care and comfort to the people and the women of Ba. With those words, am I supposed to open it here, or is it going to open it there? We'll open it there. So I will save my words for opening. Thank you very much. I'll cut this first.
Okay.
Okay.
Okay, with these scissors, this one I'm holding in my hand. I'm cutting this ribbon to officially open the extension to the women's ward.
Naka.
And also, how do I do this?
Just one side. Pull
Just one side.
maybe.
And there's my name.
Yeah.
There you go.
I'll fix it for you. What we can do is.
So I have my name up in Ghana.
Yes.